Hello, I'm Sheryl McCarthy. Welcome to One to One. By 2030, 1 in 5 Americans will be 65 years old or older, and the number of elderly living with dementia is expected to reach 8.5 million. More Americans will require around-the-clock care, someone to cook and clean, bathe and dress them, run errands, and administer medicine. For the poorest, Medicaid will pay for nursing home care, even though Americans universally say they would prefer to be cared for at home. Meanwhile, middle-class families are caught in a financial squeeze, neither wealthy enough to pay the high cost of full-time care at home or in a private facility without exhausting their resources, and not poor enough to qualify for Medicaid. To discuss this growing crisis and what needs to be done to close the long-term care gap for the elderly are Bobbie Sackman, a longtime service provider and advocate for the elderly, who is supporting a bill in the New York State Legislature that would provide universal long-term health care, and Peter Travitsky, senior staff attorney with the New York Legal Assistance Group, who works with low-income seniors who are trying to navigate the waters of Medicaid. Welcome. It's often said that the best health insurance for someone who's elderly is a daughter or a stepdaughter. Do you agree, Bobbie?
Totally. And it's a good place to start the conversation today. Growing old, going into old age and all is a woman's issue. Most older adults are women. We do still live longer. Most low income and older adults who live alone are women. Most of the family caregivers, as you just mentioned, are daughters, daughters-in-law, stepdaughters. And the workforce is mostly women. Home care workers, who are mostly women of color and immigrant women and other people who work in the workforce. And so, absolutely, that's the best long-term care insurance, which says a lot about a broken system.
Right. I think a lot of Americans assume that when they or their spouse or their parents become old and sick and in need of a lot of care, that the Social Security system is going to kick in and provide support for them. And they get blindsided by the fact that the amount of support is limited. So does this create, in your view, a crisis in long-term care for the elderly?
It's not just about being blindsided. I think it's also, there's a real gap in knowledge, I think, about how healthcare works in the country. And the example that you're both talking about is one that happens all the time. I'd say it's probably a major source of intake for us, actually, a caregiver calling because some catastrophe happened. Mom fell in her apartment, broke her hip, ended up in the hospital, then had an inpatient rehab stay. Everyone's telling her that mom's gonna need home care. And Medicare stops paying in full after about 3 weeks.
You know, after you get out of the hospital, it'll pay for either like about 3 weeks in a rehab facility or 3 weeks at home, and that's it, right?
Medicare provides home care, but it's not long-term.
Right.
That's a big misconception. At best, you're probably going to get a couple hours a day, a couple days a week, and it ends after maybe 6 weeks.
Right.
For a lot of people, that's just simply not enough to continue. The other common intake pattern we see is somebody who is picking up on the writing on the wall. Mom's forgetting where she is. Mom's not paying her rent. And people are trying to intervene at that point, but it's still, there's a lot of rules to know.
So the question basically is, okay, what do we do now?
Right.
And what do we do now? Every person who is 65 or older qualifies for either Medicare or Medicaid, correct?
Yes, but just to define some terms, because so many people don't understand the difference.
And that's my question. What is the difference?
Okay. Yeah, so Medicare pays for, Medicare is basically health insurance for seniors, people over 65 and over, or if you're an adult living with a disability for more than, I think it's like 2.5 years under Social Security's rules. Medicaid is a means-tested program, which is administered at the state level. So it's always a big topic for state budgets. And it goes beyond Medicare. It includes dental in New York, at least. I can't say that for every state. I'm actually not sure off the top of my head. But focusing on New York, it includes home care beyond the 6 or so weeks from Medicare. And you can get up to 24 hours a day if you have the medical need to support 24 hours a day.
But there's a means test for it, and that's about, what, $15,000 a year?
Oh gosh, I'm so bad at math. But the monthly limit, if you're 65 and over and single, this year is $859 a month.
Okay, but it's very low income.
Very low.
Okay, okay.
There's some good disregards, but people tend to look at that number, I think, and balk, and then run to look for other sources of support, including, as you said earlier, impoverishing themselves when they may not need to.
Does everybody else who's not at that pretty low level of income qualify for Medicare? Does everybody else?
Yeah.
Do you want to take that? Or?
Oh, no, go ahead.
Yeah. I mean, if for most people, Medicare hospital coverage is free based on your work history. For outpatient coverage, there is a premium that can be higher depending on how much your earnings were. But this year it's $135.50 a month, which is still a pretty big price tag for a lot of people.
Yeah. And Medicaid pays, for, as you said, pays for a lot more things. It pays for hearing aids and for eyeglasses and dental care, and whereas Medicare does not pay for any of those things, even though those are things that a lot of older people need. So the real gap seems to be for Medicare people. Not, if you qualify for Medicaid, you get a lot of stuff, but the real gap seems to be for Medicare people. Is that correct, Bobbie?
Yeah, and I want to add to it that a lot of people who aren't eligible for Medicaid, they're not all middle class. I want to come back to the middle class, but I really want to be clear that there are waiting lists across this state, over 16,000 people waiting for different services, older adults, because they're not eligible for the services that they would get under Medicaid. Some of these folks, their income is between $15,000 and $20,000 a year. They just don't, they're not eligible for Medicaid. But then you do get to a place where an older adult would be considered middle class. The median income in New York City for older adults is $34,000 a year. $34,000 a year, that's not a lot of money.
Right.
So when we talk middle class older adults, it's not like middle class younger people.
Right.
And I think that's important too. And as you said in your introduction, nobody can afford this. Who can afford to pay a home care worker? And if any dementia does set in and you really need more intense care, then you have to be paying more hours. And so very often, families will pay out-of-pocket costs if you have a family. If you have a family who could pay out-of-pocket costs. Very often, women, as I mentioned earlier, as a women's issue, women will leave their jobs to do caregiving. And then they have a very difficult time trying to get back in the workforce. So that's their future, their financial. So it keeps going on.
Right. And you were talking about New York. I had this issue with my own mother, who was in her 90s and getting sick. She was a retired school teacher living in Alabama. She and heart condition. She could no longer live alone. She has a pension and she owns a house. She needed round-the-clock care. She wanted to stay at home. But even if you're looking at $10 an hour for round-the-clock care, that's a huge amount of money. Right. It approaches $100,000 a year, which is more than her pension. So it's like, what does a family do? And you start scrambling. You really start scrambling. Fortunately, I had a brother who was retired and who moved from his state to come and stay with her there. But if that doesn't come together,
right,
it really is. You really are facing a crisis about what to do. And you mentioned that one often hears that middle-class people might have to impoverish themselves in order to qualify for Medicaid. Have you actually seen that happen? Have you seen that happen?
Well, you've probably seen it, you might see it more as a lawyer, but I can tell you for a fact, my family did this in Florida. My parents are gone now. And after my father died, we put money in trust for my mother, so she won't get arrested. We won't get arrested. She's gone. And there's what they call a look-back period for nursing home care. So you have to do any transfer of funds for 5 years before someone goes into a nursing home. But for home care, I believe there is no look back, and it's different in every state.
Right.
New York tends to be more generous than a state like Florida. And so what happened was my mother died at home. So it turned out none of this was necessary. And in that sense. But what happened was we were protecting her money. Now, she totally trusted us.
So basically,
too. We
you
weren't gonna use
transfer
it.
the assets
In the
and
name
put
of
them
me
in
and my
trust
sister.
for the children or whomever, so that the person can qualify for Medicaid. a
If they
nursing
need
home,
it.
Right.
She
or
actually never
whatever,
did, but yeah.
And without Medicaid coming after the house.
So you have middle-class families across the nation that are doing this, and some folks might, and there's other technical terms, pooled trusts, and some folks might say that's cheating, that's not right. I say it's the only game in town, because we don't have a long-term care system that's not going to, just leave you with no money and impact your whole family. You might still be raising children. That's why we need to fix a very expensive and broken system. I also, if I could just jump in for one moment, when you talked about your mother's experience in Alabama, in New York State, and I have a feeling it might be true in most states across the country, we have a home care crisis. We don't have enough home care workers. We have a shortage, especially when you go more in upstate New York. And part of that is because we don't pay them well, we don't train them well, we don't treat them well. There's a lot of injury on the job, and these are mostly women of color and immigrant women. So we've got a system that's really on the backs of women in many ways.
Right. Peter, you deal primarily with people who qualify for Medicaid. And you suggested to me when we talked the other day that the situation in New York is not as dire as in some other states, right?
Oh my gosh, yeah. But actually, before I answer that, I would love to jump in on the question that you asked Bobbie about people impoverishing themselves, because one unfortunate, I think, misconception about the Medicaid rules, there's also an asset test. In New York, it's actually, I think, a little bit more generous than many states. It's $15,000 here, which is still, I think, low for a lot of people, especially in New York City.
$15,000 in assets or $15,000 in income?
Assets.
Okay.
The $15,000 number that you were talking about earlier, I think that you may have been thinking of the asset limit. I was trying to do the math in my head and I couldn't figure out where it came from. But so a lot of people see that number and they have a tiny panic attack because they've been saving their entire lives for retirement. And I'm not talking about a savings account that you have set aside for retirement. I mean like an IRA, a 401k, a 403b, if you were self-employed, a KEO account, right? If you have an account that is set up specifically for retirement, there's a rule under Medicaid that as long as that account is in payout status, in a way that's tacked onto your life expectancy, the principal is not counted toward the $15,000. So one of the most heartbreaking things for me is when people come to our office and tell us that they spent all of mom's retirement money on the home care, not realizing that they didn't have to do that. Also, now your question though was about, is there a home, that the crisis isn't that bad and compared to other states? Yeah. New York, I think, is one of the few, if not the only state left. I don't want to say that with any, I'm not certain of that, but I know it's not a majority rule where you can get 24-hour care. Also, there is no waiting list for Medicaid. I think Bobbie was talking about another program.
Okay.
But there are delays in accessing services. It's not like you go sign up for Medicaid and your home care starts the next day, which under the Affordable Care Act, if you applied for Medicaid, you actually could get Medicaid right away. But for people who need long-term care that are 65 and over, you're looking at, if everything goes smoothly, assuming there are no hiccups along the way, 45 to 60 days for the application to be approved. Then you have to be evaluated by a nurse that contracts with the state to ascertain whether you actually need home care, and then you have to pick a health insurance plan that contracts with the state to provide the services. And from start to finish, that can take like 4 months.
Okay.
There is a process that you can utilize to get home care quicker, and the county administers that, and then after a few months pass, you can get assigned to a health plan called Immediate Need, and we have a lovely article on our health advocacy website that walks people through that process. From start to finish, that's supposed to take 2 to 3 weeks, which is much better, I think, than probably anywhere.
Okay. Okay. We're going to take a short break. Then we'll be back with Bobbie Sackman and Peter Travitsky after this message. Welcome back to One to One. I'm Sheryl McCarthy, and I'm talking with Bobbie Sackman of the Caring Majority and Peter Travitsky, Senior Staff Attorney with the New York Legal Assistance Group. So let me get this clear. If you qualify for Medicaid, they will pay for round-the-clock care for you at home in New York?
If you qualify, yes.
If you qualify. Or they would also pay for, a nursing home, correct?
Yes, and as Bobbie mentioned before, if it's nursing home care, there is a 5-year, it's called a 5-year look back. You turn in 5 years of all of your bank statements to allow the city, well, the county rather, to determine whether you did in fact transfer money for the purpose of qualifying. For home care, there's no look back.
Okay, okay. But in New York, if you are on Medicare, do you have access to round-the-clock home care? No.
No.
That doesn't exist. That doesn't exist. You have to take care of that yourself.
Anywhere, not just New York.
Yeah,
Right,
that's national.
right,
Yeah.
right. So is that where the gap is? Is that where you see the gap being?
So yes, in some ways. When Medicare was enacted in 1965, it's a long time ago, nobody was talking about long-term care then. And in fact, on the federal level, the House bill in Congress includes long-term care. The bill in the Senate does not include long-term care.
Okay.
So there's still this struggle going on about
Okay.
Medicare and what it should cover. And so that is the difference. Medicaid, as Peter has been saying, will cover long-term care. And so sometimes, so what's happening is somebody is being assessed not on their need, but on their income. Because somebody who's not eligible for Medicaid, it doesn't mean they don't have the same need as somebody who is eligible.
Right.
They just don't have the proper income eligibility.
Right, right.
And that's where people are sometimes on waiting lists for services, but they're also just frankly falling, I call it the rabbit hole. There's a crisis and your family just gets swept
Right,
away in this
right.
rabbit hole.
Even if, you qualify for Medicaid and Medicaid would therefore pay for you to be in a nursing home, the nursing homes that accept Medicaid patients are not always the greatest places, right?
I believe in New York, every nursing home is supposed to accept both, I believe.
Okay.
So I don't know if that's necessarily true.
If I could just add to that, you could enter a nursing home and spend your life savings in a month.
Oh.
Yeah.
So everyone ends up on Medicaid eventually. I mean,
Okay.
unless you really do have a lot of
lot of
money. And if you
resources.
have a lot of money, you probably won't go into a nursing home because somebody will keep you home.
Okay.
But they're so expensive that you're going to use up that money really, really quickly. So in essence, all the nursing homes have to accept Medicaid.
Okay. Okay. But I mean, I'm raising the question there, if we talk about gaps in care, there are a lot of nursing homes where you would not necessarily want your to go
that's
or
absolutely,
have your
of course,
parents
of
go.
course it's true. And there are people that end up in a nursing home because there's no home care for them, or they're on their own. They don't have family, and they might end up in a hospital, and they don't the staff in the hospital doesn't know where to discharge them to, or they end up in a rehab facility, and it's hard for them to go home because they can't afford home care. So there's a lot of twists and turns, and some people end up in a nursing home that don't necessarily need to be there.
Right.
And Western New York and Northern New York, it can be very difficult to get an aid, even if you would qualify for home care.
Yes.
Because they just aren't.
They don't exist.
Okay.
Well, I also
There are
the
few of 'em.
transportation. I mean, there's so many factors, but yes.
So,
It's hard
just to piggyback, what goes on around the state is, yes, absolutely transportation, especially if you're in a rural area. But you know what? Even in New York City or a suburban area, if you have to go from client to client, you could be schlepping around the city, you know. So it is transportation. It's also the number of hours, is it worth it for the home care worker to travel to somebody? It's the pay. And people don't want to it's very difficult work, and they're not being trained and paid properly. So we have a situation where the older adult population is growing in leaps and bounds in New York City and across the state, and we don't have a home care industry that's growing with it. So what does that do? It puts it back, if there's a family, it puts it back on the family,
Right.
or you might end up in a nursing home.
And people
That's
say
it.
overwhelmingly that they would rather stay at home.
Oh, totally,
Okay.
which
Bob-
is not surprising.
Bobbie, you're involved with supporting a bill that's before the New York State Legislature that would address the issue of long-term care for the elderly. Could you tell me briefly what the bill would do?
Thank you for asking. So it's called the New York Health Act. And the New York Health Act is a single-payer bill. It's been around for many years. The really good news, I think, for long-term care is that the bill was reintroduced on February 11th. I was in Albany with many others. And now there is language in there to include universal long-term care. And what that means is you will be assessed on your need and not your income. So you remember what I said a little while ago, need and not income. So there wouldn't be waiting lists. And this is like landmark legislation. Other states have tried to do single payer. It is difficult, but nobody has included universal long-term care in it. And this would take the burden, so to speak, off of families. It would be a measure of stability in somebody's life. Caregivers are still going to care for their loved ones because they love them, but they don't have to struggle with insurance companies, with lack of home care, and maybe even leave their jobs. So it would really give them a strong foundation.
Somebody who's facing this situation, their own health is declining, or the health of a spouse or parents declining, where can they go for help? What should they do?
Well, I think if they have some resources, financially speaking, it's good to get ahead of the issue. There are private elder law attorneys that help specifically with that issue. If they are just a concerned caregiver and want to get ahead of the issue, I have to say, New York State is, our health advocacy community is pretty, I think, robust and connected. I feel like if you were to go through the wrong door with one advocacy group, somebody there would probably get you to the right one. So for instance, I don't work with people who are under 65 that are not disabled because I don't handle New York State of Health Affordable Care Act Marketplace Medicaid.
Right.
But I know where I could refer someone first.
Okay.
With that.
So they should come to your organization, perhaps.
And maybe I can just connect them to the right person at the organization.
Bobbie?
So I'm doing work with the New York Caring Majority Coalition, and this is the coalition, among other groups, that are working to get this New York Health Act passed, that has long-term care in it. So if you're interested in that, you can contact NewYorkCaringMajority.org.
What's the likelihood it's going to pass?
I think the likelihood is that it is going to pass. I can't tell you when it's going to pass. This is a big bill. This is a huge change. We already have a coalition working against us of health insurance providers, hospital associations, for-profit nursing homes. Everyone making, money out of this system is already coming together to oppose it. So we're just going to push forward. The Assembly had passed it for years. The Senate was only one vote shy, and it's now Democratic. So we got to see if they can put their money where their mouth is, and really pass this bill. And so we're pushing ahead.
It would certainly be revolutionary.
It would be, you know, it's revolutionary, but if I could just add really quickly, look, I've been doing this for 30 years. I'm obviously have aged into my own field. I also think this is something for my field, for my generation to leave as a legacy. I mean, I'm not going anywhere yet, but I want it for myself and my peers that long-term care. But also, you know, a lot of advocacy is for the person behind you.
Right.
And so this is never going to change. So the adult children who are already taking care of, let's say, their parents, this would benefit them. But someday it's going to benefit them. So I feel like this is also a legacy issue. We as a society have created this monster healthcare system, including long-term care in that. And how do we fix it? How do we make sure that everybody has a stable way to grow old, that they don't have to just be, you know, shivering and shaking in their boots?
And they and their families don't get blindsided by it.
Totally.
Okay. We're out of time. I want to thank Bobbie Sackman and Peter Travitsky for joining me today. If you're interested in joining the Caring Majority, you can contact nycaringmajority.org. And if you need care for an elderly family member or for yourself, you can contact 212-613-5000. For One to One and the City University of New York, I'm Sheryl McCarthy.